Welcome to an AFSA presentation on asthma. This presentation has been kindly sponsored by Aspen Pharmacare. This presentation aims to give you a better understanding about asthma. You may have wondered, why am I dealing with asthma when the people around me aren't? Asthma happens when you develop chronic inflammation of your airways or the tubes that help you breathe. The inflammation often causes symptoms, and the airways may also react strongly to triggers like a viral infection, pollution, exercise, cold air, or things that you are allergic to. The chronic inflammation may cause less severe symptoms and injury to the airway, but your airways may get very tight, making it hard to breathe when they are triggered. Asthma results from changes to the way that your immune system reacts in the airway. These changes can be linked to certain genes, it may run in your immediate family, and factors from the environment that may influence the way that your immune system reacts. For some, asthma can appear during childhood, while for others, it might show up later in life. The immune changes seen with asthma may also affect other areas of your body. If you have asthma, you might also have, or develop other allergies, like allergies of your nose, which is allergic rhinitis and hay fever, or eczema, which is also known as atopic dermatitis. But, the good news is, understanding asthma and knowing your triggers can help you manage all of these conditions more effectively. Our goal is to help you understand why your body reacts the way it does and to empower you with tools to manage these symptoms effectively, so you can feel better and more in control. Let's explore how we can manage asthma together. We have much to cover in this program. Let's get started with, what is asthma? Asthma is a condition of chronic inflammation of your airways. The inflammation varies over time and may result in episodes where your airways overreact to certain triggers and cause severe narrowing of your airways. Triggers can include viral airway infections, allergens, cold air, or exercise. This inflammation causes narrowing of the airway, with increased mucus production and spasm of the muscles of the airway, making it hard to breathe. Now let's look at the role of inflammation. Inflammation is the root cause of asthma symptoms. It makes your airways swollen and sensitive. You will often not know that the inflammation is there, but times come when the inflammation worsens, causing coughing, wheezing, and chest tightness. Reducing inflammation with daily medication prevents inflammation, protects you, and helps keep your symptoms under control. Let's look at, how well is your asthma controlled? The inflammation that is associated with asthma must always be well controlled. Uncontrolled inflammation may result in symptoms and possible deadly chest tightness. Uncontrolled inflammation also causes slow damage, or scarring, to the airways. It's important to know if your inflammation is controlled or not. The presence of any asthma symptoms confirm that your inflammation is not controlled. The doctor also uses other measures to decide if your inflammation is controlled or not. Managing asthma involves avoiding triggers that can irritate your airways, like smoke or cold air. Daily controller medications reduce airway inflammation, while reliever inhalers provide quick relief if symptoms occur. There are two main types of asthma medications. Controllers are taken daily to reduce inflammation and prevent symptoms, while relievers are used only when you need quick relief. It's important not to rely only on relievers or oral steroids, as they don't address the root cause, which is inflammation. Taking your medication daily, even when you feel fine, is essential. It prevents inflammation from building up, reduces the risk of flare-ups, and allows you to live a full and active life. Reliever inhalers are great for quick relief, but they only treat symptoms, not the underlying inflammation. Overusing them can hide worsening asthma and increase the risk of serious flare-ups. Daily controller medication is the best way to manage your asthma long-term. Relievers should never be taken alone. You may use additional inhalations of your corticosteroid-only controller with your reliever, or ask your doctor about a combination inhaler that also contains a rapid onset reliever. Asthma doesn't mean you need to stop doing the things you love, like playing sports or staying active. Warming up before exercise and using your reliever inhaler, if needed, can help prevent symptoms. Talk to your doctor if your asthma symptoms are getting worse, waking you up at night, or if you're using your reliever inhaler more than twice a week. Adjusting your treatment can help you regain control. Asthma is a condition you can manage. By taking your medications, following your action plan, and staying active, you can live a full and healthy life. You've got this. You have now completed all of the items. If you have any questions, reach out to your healthcare provider or visit www.allergyfoundation.co.za for more information. These resources are here to support you in managing your allergy safely. Great that you could join us on this asthma journey. We trust that this presentation has helped you to better understand your allergy, to recognize the symptoms, and to know what to do in case of an allergic reaction. Please join us for the 2025 free allergy education workshops. Go to our website, www.allergyfoundation.co.za for more information about your allergy, and for the allergy education workshop dates. As a final step, you are now going to watch a short AFSA video.
When you have difficulty breathing, you need to use an asthma pump.
No, Mpilo, you need to use a spacer to get the medicine to work properly in your lungs.
Inhalers contain the medication needed to treat your asthma, but the medication must be delivered to the lungs. The AFSA spacer is a spacer device which slows the speed of the spray down and helps you to get more medication into your lungs. A spacer is recommended for all children and for adults with difficult to control asthma.
Remember what I said, Mpilo?
I shake my pump and put it in the back of my spacer. I put my mouth over the valve.
Make sure the valve is between your teeth and your lips are tightly closed so nothing leaks out. Are you ready, Mpilo? Okay, now breathe slowly and deeply all way in and all way out. 6 times, Mpilo. Well done.
My friend showed me this cool little gadget for my asthma pump. You don't have to push down, all you have to do is squeeze, and it's amazing for little kids younger than me.
The AFSA spacer is recommended for all children and for adults with difficult to control asthma. The AFSA spacer can be used in 2 different ways. Younger children can use the AFSA spacer with the one-way AFSA valve and breathe in and out 6 to 10 times to get all the medication in the lungs. Adults and older children can use the spacer by breathing in all the air inside with one breath with the valve off.
I didn't know adults should also use spacers, but since I've been using my pump this way, I have better control over my asthma.
Shake the inhaler to ensure that the contents of the inhaler are well mixed. Fit the inhaler firmly into the AFSA spacer. Place the mouthpiece in your mouth between your teeth. Close your lips firmly around the mouthpiece, but do not bite it. Breathe out as far as is comfortable. Press down firmly with your fingers on the top of the inhaler to release one puff of medicine. Straight away, take one deep, slow, steady breath to make sure that the medicine goes into your lungs. You must inhale one puff of medication at a time and hold your breath for 10 seconds. Breathe out through your nose. If you need to take more than one puff, remove the inhaler, wait 30 seconds, and then repeat.
My doctor gave me an action plan to control my asthma. I've got 2 pumps, and the plan helps me remember which I must take only when my chest is tight, and which I must take every day.
For more information about the AFSA spacer, go to www.afrispacer.co.za or go to the Allergy Foundation website at www.allergyfoundation.co.za for information about asthma, action plans, and much more. And sign up the Allergy Foundation as one of your beneficiaries on your Woolworths My Schools, My Village, My Planet card.